Last week, the city of Papillion passed a mask mandate. While it went into effect almost immediately, it is set to expire based on the state's hospitalization rate, and that has caused a bit of confusion. Good evening, I'm Maya Signs. 3 News Now reporter Alyssa Curtis explains the measures needed for the ordinance to expire.
Mask mandate is just another public health measure, just like many other public health measures that government has the authority to impose.
At last week's city council meeting, it was decided that Papillion would join surrounding cities in enacting a mask mandate. It was passed with an emergency clause, meaning it went into effect almost immediately. But it was also passed with a sunset provision. There's no set date for when it will expire.
Rather than pick a date on the calendar, we wanted to tie it directly to COVID statistics.
The mandate will end once the state's active hospitalizations reach 20% on a 14-day average.
For daily active hospitalizations, and then we're taking those numbers and using them on a 14-day rolling average. So taking, like I say, the last 14 days and averaging them from the overall total hospital beds in the state.
This ties into Governor Ricketts' yellow phase of COVID in the state.
It just made sense to us that, also to use an average of those active hospitalizations so that you really do have more of a real picture of what's going on.
For the past 2 days, Nebraska has hit that marker. But Councilmember Tom Mumgard says you can't take this decision day by day.
The need, if you're measuring the need can't be measured on a day-to-day or even week-to-week basis. It has to be a longer time period. So that 14-day average seems to fit with the incubation period.
In Papillion, Alyssa Curtis, 3 News Now.
If the mask mandate were to expire based on the sunset provision, the council would have to go back and vote once again if the numbers were to spike.